from Miami, Florida. Tonight we have the pleasure of having the team, soon to be expanded, of RealDx.com, an unusual educational, medical educational site that has the patient doing the teaching. So I'll introduce Dave, and then you can introduce Andrew. Good evening, Dave.
Hey, it's an honor to be here and on board with InternetMedicine.com. We're delighted and honored to be hosted by you, and appreciate, John, you're willing to host us. And I'm David Spiro, and I'm the co-founder and chief medical officer of RealDx. Our company is grounded in real patient video and developing a platform for physicians to shoot, upload, store, and share video in a way that is meaningful to them, and for multiple applications to improve healthcare, one of which is medical education, which is what we've started with, and we're excited to show the audience today what we're doing, specifically around medical education and the future of where RealDx is headed to improve healthcare as a whole using real patient education. And I've been incredibly privileged to have one of the most amazing members of the teams, just amazing team members. And I'd like to introduce both Bill and Andrew, who are here with us, and they can explain a little bit about themselves. Bill?
Sure, thanks, David. I'm Bill Kelly. I'm the co-founder and CEO of RealDx. David and I have been working on this for just about 2 years now, and it's been an awesome ride and an awesome journey, and we're learning a lot and starting to see some really interesting results of our work. So we're excited to be here to talk about it today.
Welcome, Bill.
I guess I'll go. I'm Andrew Richards. I'm the Chief Technology Officer for RealDx. And my job is to take all these awesome ideas that we have and make them a reality. And it's been an adventure, but we're in the process of building some great open APIs, some cool mobile applications. And these are going to supplement the medical education platform we've got running right now and some of the great stuff we're already doing in the field right now. So I'm just really excited to be part of this team, and I'm really happy to be on this hangout. And thanks, John, for making this happen.
Okay,
Great,
Dave.
well,
Go ahead, Dave. Take it.
yeah, so I thought maybe we could start off the presentation. Again, our platform is built so doctors and all health providers, for that matter, can shoot, upload, and store, and then share video content that is useful for them, useful for their team, useful for their institution, useful for the greater good. We started off with the latter, the greater good, in regard to producing content in 3 separate libraries. One is Pediatrics, one is Emergency Medicine, and one is Pre-Hospital Care, which are ambulance-based cases by paramedics and EMTs. And what I thought we would do is I would share my screen, and with that, I will show the audience a little bit of what we're doing. So, Bill, does this look okay to you?
Yep.
Great.
Why don't you make that full screen, and it would be even better.
Yeah, it acts kind of funky sometimes. It goes back and forth.
So hit the green button.
Yeah. It's kind of temperamental.
Because right now it's full screen on my computer.
Yep,
Yeah.
looks good.
Okay, great. So this is the medical education app that we have, and it's quite easy to navigate. We have featured cases, and those of you that want to join RealDx can do so because it's free. And all you need to do is to get on to RealDx.com or meta.RealDx.com and click a simple button called Join Us. Register, takes less than a minute, and get to view some of our cases. I think what we'll do is start off with one of our newest cases. We are fortunate enough to have a, let me get out of
Excuse me, Dave. Are you seeing the blinking? Is it blinking back and forth for you too, or I don't know?
It is not blinking back and forth for me.
Oh, okay. Well, I guess I'm.
John, I think if you click on David's icon down in the bottom, it will fix your screen on his.
Oh, okay. That's a good idea. You're doing my job, Bill. Okay.
Lessons learned through hard experience.
Okay.
So here's a case. We're very fortunate to have a project with the state of Oregon, where and the state of Oregon Trauma Service, Emergency Medical Services Committee for Children, has given us a grant to work on shooting real patient video with paramedics in the state of Oregon, primarily for teaching purposes. And this is the way that we've set up our learning module, where there's a case here, and there are real patient vitals and other information, history as such, an ability to comment, because we are creating a community at RealDx, a community of real patient learning, outcomes in terms of what actually happened to the patient, an ability to reveal the diagnosis which is hidden, still pictures associated with the video case, and suggested approach. Each of our libraries have authors, an editorial board that is a peer-reviewed process. So let's take a look and see this video. Hopefully you all can see this real time through the Google Hangout.
So good morning. Can you tell me kind of what happened this morning?
Me and my friend Ryan, we decided to go on a bike ride to go have lunch with my mom. And he had to go to the bank to get some money and super. And
What happened when you got hit? Tell me that. A car hit you? Okay. Did it run over you?
yes,
Okay. Do you know what wheel ran over you?
it's front right,
Okay.
and then back, and the back right.
What kind of pain are you having today?
Chest,
Are you able to take a deep breath?
kind of.
Kind of. Does it hurt on this side where the mark is? Okay. I see you have some abrasions on your elbow. Underneath. And then down here on your leg. Does your leg hurt? Your foot does? Can you wiggle your toes for me? Good job. Does that hurt when you do that?
Sort of.
Pardon me? Sort of hurts? Okay. Did you lose consciousness when you got run over? Do you know what day today is?
June. Can't remember.
Okay, do you know what day of the week it is?
Friday.
Friday? Okay. Can you tell me your mom's name?
Tina.
Okay. Does your neck or back hurt?
Sort of my back where it hurts to breathe.
Okay.
So I think, Bill and John, were you able to hear that okay?
Yes.
Great.
Yeah,
You know,
it sounded good.
This is maybe the 10th or 15th time I've seen this video, and every single time that I take a look at these cases, I learn something new. And no one has done this before. No one has actually figured out a way to consent patients, create a HIPAA waiver, which people do all the time in hospitals for various reasons, and create a library where patients are voluntarily allowing themselves to be videotaped for teaching and or quality and or other reasons. And the first thing I'll say, and I say this before I speak because I've spoken in small groups and large groups around the country around this, is I think we all at RealDx, and I personally as a physician, am extremely grateful to all of the families that have participated in this project. They are the real heroes. They are giving of themselves in the middle of a crisis at times to allow others to learn from their injuries and or their medical problems. And I just want to emphasize that that is a huge part of what we are. I think there is a sense of greater good that we are all participating in regard to this project and in our mission. And I'm certainly proud of that. I'll show you another case. Like I mentioned, we have. Go ahead.
I was going to say, before you moved on, can you highlight the URL at the top there real quick?
Yeah.
I just wanted to point that out. For anyone that is watching right now, these are featured cases. You can go there and you can watch this right now. So, if you go, wow, I want to learn more about that. If you look up there, I think it's this case. That one's 156. I think the last one was 411. You can go there and check them out. So this is, you can get access to this right away if you want to learn more. So sorry, David, keep going. I just wanted to point that out.
I appreciate that, Andrew. And we've worked with various organic folks in regard to the Twitter community and Facebook community who enjoy actually discussing a case and taking the URL and linking it within their community to discuss, and they're certainly welcome to do that. Obviously, those that have to click on the URL will need to register. Here's another case completely opposite of the previous case that's shot in a pediatrician's office here in Portland, Oregon.
We're here today with my friend Elizabeth, who is an 8-year-old, who's going to show us this cough. How long have you had this cough for, my little friend?
Well, I've always thought, once summer started, I sort of got it all out, and, well, it sort of was starting to last through.
That's a while. That's many months now, huh? And does it hurt anywhere when you cough?
No, not exactly, but I feel a little tickle sometimes.
Where's the tickle? Can you point to it? Thank you. Can you give us this little cough now? That's a wonderful. You want to do it one more time for fun? That is excellent. Thank you very much.
So, the teaching point here is this is a psychogenic cough. Obviously, she's fine, and there was a behavioral component to it. But these are very, very difficult to sometimes figure out, and oftentimes children go through procedures and thousands of dollars of tests to get to this result. And the idea of creating libraries, and our vision is tens or hundreds of thousands of cases that will be logged in our platform for students and practitioners to learn from. The opportunity is enormous, and that are literally just examples at this point of what can be done, what the power of our platform will be able to do. This case is representative of that, because this is psychogenic cough. It can be very challenging to figure out. Here's basic information about the case, some actual outcomes, what actually was done in terms of the patient workup, suggested approach, some suggested references, and key points around this case. So that's essentially what I'd like to do in terms of the screen share, and now I will turn it back to the panel. And I'm curious, Bill, is there anything else that you would like to add, or Andrew, in regard to the platform?
I'd just add that the platform is really designed to facilitate. David, could you put your computer on mute? I'm hearing myself.
Jeremy, hit that.
That's one of us, I guess.
Or maybe, I don't know.
Is that better?
Yes.
That's better.
Much better.
That's good.
It's your fault, David.
Sorry.
No, the thing that I'd say about the platform is just that in the past year of working on this, we've really started to realize the power of video in clinical medicine. It's interesting that video itself is such a powerful communication tool. Here we are using video in a live